Folate's role in preventing neural tube defects during early pregnancy is widely acknowledged and forms the foundation of public health policies that promote folic acid supplementation. Yet, its importance during pregnancy extends well beyond this one critical window of fetal development. Emerging research is steadily uncovering folate's broader and more nuanced contributions to maternal health, placental function, and long-term outcomes for both mother and child. Rather than being confined to the first trimester or limited to a single protective effect, folate appears to be a sustaining force throughout gestation, buffering metabolic stress, reducing the risk of obstetric complications, and optimizing fetal growth in ways that are still being fully understood. One of the most promising and underappreciated areas is folate's potential role in reducing the risk of gestational diabetes mellitus, GDM. GDM occurs when a woman's blood glucose levels rise abnormally during pregnancy, increasing risks for complications such as macrosomia, cesarean delivery, and even future type 2 diabetes for both mother and baby. Folate, through its involvement in 1-carbon metabolism and methylation, may influence insulin sensitivity and inflammatory signaling pathways. Some studies suggest that adequate folate, particularly in bioavailable forms, helps maintain metabolic equilibrium in the face of rising insulin demands during pregnancy. When folate levels are suboptimal, homocysteine levels tend to rise, which is associated with oxidative stress and endothelial dysfunction, both of which impair glucose regulation. By keeping these processes in check, folate may serve as a subtle metabolic stabilizer in a time of heightened hormonal flux. Another increasingly recognized benefit is folate's potential to reduce the risk of preeclampsia, a dangerous condition marked by high blood pressure and proteinuria that can threaten the lives of both mother and fetus. Preeclampsia has roots in abnormal placental development and poor vascular remodeling, both of which are influenced by methylation status and nitric oxide bioavailability. Folate contributes indirectly to nitric oxide synthesis by facilitating the recycling of homocysteine and ensuring that endothelial function is maintained during the vascular adaptations of pregnancy. Some observational studies have shown that women with higher folate levels have lower incidence of preeclampsia, especially when supplementation begins before conception or early in the first trimester and continues consistently. The mechanistic link is compelling. Folate helps build the placental architecture needed for nutrient and oxygen exchange while simultaneously lowering vascular inflammation, a dual effect that may offer long-term cardiovascular protection as well. Perhaps even more quietly impactful is folate's influence on fetal growth and the prevention of low birth weight, LBW, a condition that can predispose infants to developmental delays and chronic disease later in life. LBW is multifactorial, but maternal nutrition plays a central role. Folate supports the rapid cell division required for placental growth and trophoblast invasion, which are essential for ensuring that the fetus receives adequate nutrients. When folate is deficient, placental insufficiency may limit nutrient delivery and compromise fetal development. Supplementation has been associated with reduced rates of intrauterine growth restriction and improved APGAR scores at birth. While neural tube closure occurs by the 4th week of gestation, fetal organogenesis, brain development, and skeletal formation continue throughout the pregnancy, and all rely on folate-fueled DNA synthesis and methylation to proceed without interruption. Folate may also shape the fetal epigenome in subtle but lasting ways. Methylation patterns established in utero influence gene expression far beyond birth, with potential effects on immune function, metabolism, and even mental health. Adequate maternal folate status supports this foundational epigenetic programming, possibly lowering the child's lifetime risk of obesity, allergies, and insulin resistance. The methylation of specific imprinted genes, those involved in growth regulation, placental function, and hormonal balance, depends on maternal folate availability, suggesting that its benefits ripple across the child's biological future. These effects are especially critical in the context of the first 1,000 days, from conception through the second year of life, a developmental window during which nutrition sets the trajectory for lifelong health. Interestingly, the form of folate may also matter more than previously assumed. While folic acid is the synthetic version used in most prenatal vitamins and fortified foods, individuals with MTHFR polymorphisms, a common genetic variant affecting about 10 to 20% of the population, may have reduced ability to convert folic acid into its active form, 5-methyltetrahydrofolate, 5-MTHF. For these individuals, supplementation with methylated folate may ensure more reliable bioavailability, reducing homocysteine more effectively and supporting all of the downstream benefits previously discussed. This highlights the growing relevance of personalized prenatal care and nutrition, where one-size-fits-all supplementation may not be sufficient for all women. Despite all this, the conversation around folate in pregnancy remains largely anchored in neural tube defect prevention, a message that, while vital, leaves much of its power untapped. In truth, folate is a cornerstone nutrient not only in fetal neurodevelopment, but in every aspect of gestational health, from the placenta to the pancreas, from vascular regulation to epigenetic inheritance. Its benefits are not only preventive but potentially transformative, supporting the resilience of both mother and child across multiple systems. When we consider pregnancy not as a brief biological event, but as a highly orchestrated process of growth, adaptation, and intergenerational signaling, folate emerges as far more than a neural tube safeguard. It becomes a nutrient of continuity, quietly anchoring a state of health that spans organs, time, and even generations.